Hi, this is Sarah Fleming, the Site Director at the Toronto Western Family Health Team University Health Network. We are currently located at the Toronto Western Hospital at the corner of Bathurst Street and Dundas Street West. We are easily accessible by TTC with streetcar and bus stops in close proximity, as well as on-site parking available. We are situated in a lively part of downtown Toronto, close to the shops, cafes, and the established neighborhoods of Kensington Village, Little Portugal, Little Italy, Chinatown, and Queen West. While still affiliated with the hospital, in fall 2019, we will be moving across the street to a new building and clinical space, pictured here. Our family health team provides care to a rich and diverse patient population. We care for people of all ages, from newborn care to care of the elderly. We have patients who are newcomers to Canada and those who have lived in the neighborhood for decades. The people we serve also come from diverse socioeconomic backgrounds with an array of healthcare needs, helping to ensure comprehensiveness in your family medicine experience. We are an academic family health team that, in addition to residents, welcomes medical students and learners from many healthcare fields. We have a highly integrated and robust postgraduate program, training up to 28 residents per year on site. We have dedicated and experienced teachers with a multitude of clinical and research interests. We are a horizontal program where residents return for 3 clinical half-days per week, every week except on high acuity rotations. Residents build their own roster of patients, allowing you to care for a mini practice over the duration of your training. In each of your PGY1 and PGY2 years, you are paired with a primary preceptor to help oversee your training and foster continuity in your education. As shown, there are 9 core rotations in PGY1 and 6 in PGY2, with a notable 11 electives over the course of your training. 5 of the electives must be from our selectives list to ensure breadth. These include a mandatory emergency medicine selective and other options such as pediatrics, international medicine, home care, long-term care, psychotherapy, and so on. The significant elective time allows you to better tailor the program to your learning needs, but also requires a high degree of organization and personal responsibility. We support residents in finding electives with a host of commonly used and highly reviewed experiences to choose from. Here is a sample week from the Family Medicine Enrich block in the PGY1 year. Clinical highlights at our site include special family medicine-centered experiences, such as the Family Inpatient Service, inpatient care delivered uniquely by our family physicians on the wards of Toronto Western Hospital. Similarly, our obstetrical care program offers family physician-led care with prenatal care offered on-site and deliveries performed at Mount Sinai Hospital. We have an active roster of patients who receive care in their home as part of our home-based care program. Residents follow 1 or 2 homebound patients over the course of their training. We also have a procedures clinic where residents get experience in common procedures under one-to-one supervision with family medicine staff. Finally, we have close partnerships with several consultants, such as a pediatrician, general internist, palliative care physician, and psychiatrist, who spend half-days in our unit seeing our referred patients and are readily available for questions. This is in addition to a large referral base within UHN and elsewhere. Education highlights include our Partners in Care course, 2-on-2 training that focuses on the delivery of patient-centered care, time management, and agenda setting in Year 1, as well as providing in-depth CFPC exam preparation in Year 2. We have a new portfolio course to help support reflective learning about one's identity as a new doctor and various wellness topics. We have a strong ethics curriculum and Doing It Better rounds, where we carry out a significant event analysis in a supportive large group environment. The list goes on, but I will note that we have excellent site support for resident quality improvement and academic projects. Your wellness is a top priority, and we want to help you be the best doctor you can be. You will have multiple layers of support at the Toronto Western Family Health Team. We have many dedicated and caring teachers and both site-specific and central resources readily available to you. In addition, there are resident social representatives and a social budget to facilitate dinners, parties, and retreats, in addition to family health team-wide events such as your welcome breakfast and holiday and graduation parties. Residents will also have a new designated lounge fitted with a TV and couches for when you need a break. We would love to hear from you. Please reach out if you have any questions at the contacts shown here. Many thanks, and we look forward to working with many of you.